How to interpret your scan results. Now, pregnant women, when you go for scan, there are usually some terms and abbreviations used that sometimes you don't really understand. Now, this is how to understand your scan result. The first one is presentation. They will say either cephalic, breech, or transverse. When it's cephalic, it means that the baby is coming with the head. When it's breech, it means the baby is coming with the bum or the legs. When it's transverse, it means the baby is lying horizontal in the tummy. Now, the only presentation that favors vaginal delivery is the cephalic position. Now, another abbreviation you will see is EDD. EDD means expected date of delivery. Another term you might see is LMP. LMP means last menstrual period. Another abbreviation you will see again is EGA. EGA means expected gestational age. That is the present age of the pregnancy in weeks. Usually it's calculated in weeks. Then AF means amniotic fluid. So in the result, it might be adequate or inadequate. FHR means fetal heart rate, usually between 110 to 160 beats per minute. In my last video, I mentioned 130 to 160, but 110 to 160 is also okay. Then EFW means expected fetal weight. That is depending on the age of the pregnancy at the time of that ultrasound. The expected fetal weight at that time will also be mentioned. Then another one that you see again is placenta. They will either say the placenta is anterior, posterior, or low-lying. When the placenta is anterior, it means it's in front of the uterus. When it is posterior, that means it's at the back of the uterus. Then when it is low-lying, that means it has left the upper segment and now at the lower segment, very close to the opening of the cervix. And once it covers the cervix, then vaginal delivery is not advised. Then there's something else you also see called impression. They may say a singleton fetus with gestational age of 20 weeks with no gross fetal anomalies. It means that the baby is single, not twin. It means that the baby is 20 weeks, there's no abnormality seen, and the gestational age is 20 weeks. That's what it means. So with these little things, now when you do your next scan, you'll be able to see, you'll be able to interpret some of the results. So it's not every time you look for somebody to interpret it for you. You can also learn it. It's basic knowledge.